In this video I'm going to give a quick summary of the different complications in diabetes. I'm also going to use a structure so that you can remember these complications more easily. Acute complications are due to an abnormal blood sugar level. This can either be too low, as in a hyperglycemic episode, or too high. There are two conditions where a high blood glucose level is present: diabetic ketoacidosis, which usually occurs in type 1 diabetics. Here there's a combination of hypovolemia due to the osmotic diuresis from a high blood glucose level and an acidosis due to the ketone production. The other condition occurs in type 2 diabetics where there is a minimal ketone production. This is known as hyperosmolar hyperglycemic state, or previously hyperosmolar non-ketotic state, and is equally serious due to the severe hypovolemia that is present. The chronic complications are mainly due to the detrimental effects a high blood glucose level has on the vessels in the body. The complications can be separated depending on the size of the vessels where the damage is occurring. The macrovascular complications increase the risk of events such as myocardial infarctions, strokes, and peripheral vascular disease. Damage to the microvasculature in diabetes affects three organs. Firstly, the retina, causing retinopathy. Diabetes can also affect the macula, and there's an increased risk of developing cataracts. Secondly, diabetes can affect the kidney, resulting in diabetic nephropathy. And finally, diabetes can affect the sensory nerves, resulting in a peripheral neuropathy with a glove and stocking distribution. There are two other complications of diabetes I'd also like to mention. There's an increased risk of infection, such as from fungal or a bacterial source, due to the high blood glucose affecting neutrophils and other parts of the immune system. There's also diabetic foot, which illustrates a combination of these macro and microvascular complications with an increased risk of infection, resulting in a number of pathologies such as ulceration and formation of Charcot joints.